Hello guys, welcome back to the channel. This is Side Dental Vlogs. I am Dr. Abhishek Pati and I am Associate Professor in Department of Oral Medicine in Some Hospital Bhubaneswar. So आज का टॉपिक ये है कि how to start with implant practice. So I am also new to implants. Since 1 year I have been placing implants in my clinic. And how did I start? So first of all, I have not done any implant course. Till now I have done around 40 to 50 implants. And out of which two have failed also. So that is the truth I'm telling you. And this video is I'm making from my heart. And it's not I want to teach you something, or it's not like that I want to impose something on you or give you a big task. So first of all, before starting the implant process, you should have the attitude of placing the implant. That means you have to be convinced yourself that placing an implant is a better option than placing a bridge. Often at times, when a patient comes to our clinic, okay, so you can see the canine tooth is there, and the first two premolars are missing, and the first molar is also missing, and the last eight is there, or the seven is there. So what we usually do to the patient, we do the RCT of the patient of both the teeth, and then we give the bridge. But somewhere in our minds, somewhere in our hearts, we are not really convinced ki if we do the RCT of that particular tooth, what we are doing? We are doing the RCT of a very vital tooth, because we have the fear that if we do the direct crown cutting or vital crown cutting, we may have sensitivity. And in our minds, in our hearts, somewhat we are scared to tell the patient that implant is a good option for you, because if you tell the charges to the patient, then you may have a fear that okay, patient may not get it done by you, or patient may get offended because you are charging high for the implant. Because so for example, you place the bridge, and what happens is, with due course of time, in 6 7 years, sometimes you must have experience, whenever you are placing the bridge, the one tooth of the bridge breaks, or the entire 4 unit or 5 unit bridge in which you are with the vital cutting, one of the tooth will get infected. Okay, so this is the main idea. You have to get yourself convinced. How to start? How did I start my implant practice? That I'll let you know. So I started by assisting many doctors who were my seniors, my mentors. I initially, whenever the patient was going to get convinced in my clinic, I used to call seniors to my clinic, and every time I used to observe them, see them how they're doing it, and read about that process. There is a book called Kalmish, which is the basic of implantology, which we can read it, and you can know the basics. What is the implant? What is an abutment? What is the ideal case for implant? What should be the bone height? Where is the various bone densities? What is the process? So I started placing easier implants first in the lower molars, easy cases, one single cases. Then I moved on to two, three cases where I used to put bridge. Still there is a lot to learn in the implant practice. So we need to know what is the various, before placing any implant of the patient, we should see the prosthetic considerations. Means कि हम दांत कैसे लगाएंगे ये हमको देखना है. Before placing the implant, we have to plan the processes. If you are all alone, if you are only doing, you are a graduate and there is nobody in the city, you can take the help of any prosthodontist who will come to your clinic as a consultant, and they will give you the idea how you should go about the implant, where and all you need to place it. Regarding the surgeons, each and every individual has their own skills, but even if you're not good in surgery, that doesn't mean you cannot place an implant. You can easily place an implant. You just need little bit of confidence, and little bit you should know about the know-how. You should also know about the anatomy of the particular area. So whatever I would like to tell you, whenever you are going to place the implant, be a little bit strong in anatomy. Suppose where is the incisive foramen, incisive canal, mandibular canal, bone height, bone width, what. So before placing the implant, what I do is, in my practice, I tell the patient to go for a CBCT. Okay. Now everywhere the CBCT is not there, in the villages, in the suburban areas. So you can start with the IOPA. You can start placing in the lower molars or premolars. And nowadays everybody is opening CBCT units in different places. So after getting the CBCT of the patient, we know how much bone width is there, how much bone length is there. Suppose I'm placing today I placed an implant in 3-5 region, and one in the 3-6 region. And earlier I had placed in the 3-5 region with the implant had failed, and I re-implanted it. So initially the size was small, but today we had gained some space and put an implant of 11.5 mm, and the width was 3.75 mm. So we always learn from our mistakes. Whenever we start the implant in our clinic, start with calling a consultant in your clinic, see the procedure. Just don't sit in the side, see the procedure or do the suction. You will be able to know the process. Okay, what is the sequence of the drill which we are using in the implant? So the know-how that we have to gain through a lot of YouTube videos are there. There are numerous textbooks. There are numerous YouTube videos and Google and podcasts which with you can see the procedure how it is. It once you are satisfied with the procedure that whatever I'm going to do is helpful for the patient, you have to tell the patient. मैक्सिमम पीपल सब लोग इम्प्लांट के लिए क्यों मना करते हैं? दो मेन चीज के लिए. सबसे पहला इंपॉर्टेंट चीज है जो है कि अगर पेशेंट देखता है कि अगर डॉक्टर खुद कन्विंस नहीं है, अगर आप थोड़ा सा ढीला बात करेंगे पेशेंट से, नहीं हो जाएगा देखेंगे, then patient will never get done. You have to be confident in the how you are convincing the patient. Second thing about the surgery, if you tell too much details about the surgery, that a bone will be drilled and all, the patient obviously will get scared. Suppose you are going to get any kind of surgery, so obviously you are going to get scared. It's a very easy process, and it is totally by giving local anesthesia. You have to tell the patient that it's easier than doing the extraction. And पहले पहले थोड़ा डिफिकल्ट होता है. इट्स वेरी डिफिकल्ट. यू नीड अ गाइड हु कैन गाइड you to do the implant. After you place 15 to 20 implants, you will have some idea. Okay, this is the procedure. So first of all, for placing the implants, you have to invest in a kit. Try with the Israeli kits, or many Korean kits are also available, which is costing around 1 lakh to 1,10,000 rupees. So you must be thinking it's too high. So some company people are also offering, like, they will give you the physio dispenser. The physio dispenser is the instrument with which you place the implant. It's the motor in which you can fix the drill. So they will get all the instruments, and you just have to place the implant, and you have to use their implant, and you have to just pay them the cost of the implant. So initially I started like this. Whenever a patient used to get convinced, I used to call the person who is having that implant and used to bring everything. I just used to place it and pay that person. Obviously, I used to take money from the patient, but initially don't think of too much profit in the implant. Just know how to place it. Once you become the master in that, you will surely make money in the near future. Never get scared to, if you are having a good running practice, or if you are having at least 30 to 40 patients every month, don't get scared to do implants, because implants is the future of dentistry. आगे जाके बहुत boom करेगा implant. अभी भी already many cities, many places, many people are doing very good work by putting various implants like all-on-4, all-on-6, zygomatic implants. Zygomatic तक अभी मत जाइए, लेकिन basic single implant तो आप डाल ही सकते हैं. Like, the patient is convinced, make the patient wait for 2.5 to 3 months, then place the prosthetic tooth over that. बहुत लोग आप सुनोगे बोलते हैं कि सर इंप्रेशन ऐसे ले लो, ओपन ट्रे इंप्रेशन ले लो, क्लोज ट्रे इंप्रेशन ले लो, आधी चीजें दिमाग में घुसेगी नहीं, कोपिंग क्या होता है. ऐसे बहुत सारी चीजें हैं इम्प्लांट में दैट यू नीड टू नो, एंड जस्ट ओनली बाय डूइंग इट यू विल बी एबल टू नो इट. अगर आप थ्योरी पढ़ोगे तो उतना आपको समझ में नहीं आएगा. तो इन्वेस्ट लिटिल बिट, develop some interest in the implant, convince the patient, tell each and every patient about the implant. Surely the implant costs will come down in the near future because of the increasing competition, but this is the future of dentistry and you must learn it. Till then, and we'll make regular videos now. So many days I had not made particular videos, and I will surely reply to all your messages, and you can follow me in Instagram, sai_dental. Till then, take care, love you, bye bye.